Okay. Good morning.
Thank you very much, Hema.
Can you hear me okay?
Yeah, we can hear you great.
Dr. Jill Weibel from Miami, Florida, and we're here today to talk about the 595 pulse dye laser. My patient, Dr. Carter, a physician from here in Orlando. We have 4 indications we're going to treat. We're going to start this morning. Dr. Carter has an angioma on her left nasal sidewall, and so we're going to go ahead and hit that first. And what you find with this device is that it is wonderful for both cosmetic and medical indications. So, ready, Dr. Carter? Count of 3. 1, 2, 3. And this is actually causing mild purpura. That will go away in about 5 days, and that angioma will be gone. Usually just 1 treatment. As you see, there's no gel that we needed to use, and most of my patients don't like the gel because it can get in their hair, it can mess up the makeup around the eyes, and so we don't need that. Next, what we're going to do is we're going to move to treating her rosacea on her cheeks. The pulse dye laser was the first laser brought to skin. It has 15 FDA indications, over 500 publications, and very safe. All right.
Jill, I don't know if you had mentioned at the beginning, this is the V-beam, which we think of very much as the gold standard in pulse dye therapy.
Okay. It is. I use it about 10 times a day, every day. And again, in addition to using it on my cosmetic patients, it's my go-to laser for scars, port wine stains, hemangiomas. Dr. Carter, on a 0 to 10, with 10 being the most pain, what was that?
1.
A 1. Patient's very tolerable. There's also helps improve texture. You can treat the whole face. You can pulse stack this laser up to 3 or 4 times if you have a tricky area.
So, Jill, you're moving along at quite a fair clip there. This is fairly time efficient, the treatment?
Very time efficient. You can do this treatment in about 7 minutes from start to finish, which is very nice. Now, the next thing we're going to show, and we're going to switch our settings, is Dr. Carter has some prominent telangiectasias here. So we're going to switch to the 10 by 3 millimeter spot, which is going to trace out the blood vessels. This is also what you can use for leg veins, and we're going to treat right along here. This laser also can be used for psoriasis, actinic keratosis in combination with PDT. Get to know your pediatric dermatologist. They'll send you a lot of your ulcerating hemangiomas. Some of these are covered by medical reimbursement, which is nice. I tell all my residents this is the first laser I would recommend buying if you're starting practice. Okay, so if you can focus on these vessels, this is a linear spot, and it traces out the blood vessels, and you can see it, the end point turning purple. One of the great things about these devices is you know when you see that color that you've got the feedback and that vessel will go away. How you doing, Dr. Carter?
So Jill, just talk us through the time course for the vessel to go away after we see that little violaceous or bluish hue to it, which tells us we've reached the clinical endpoint of treatment.
So what's happened is we've coagulated the blood vessel, and the blood vessel will die, and then little Pac-Men will come and eat up that vessel within about 2 to 3 weeks. So you don't tell patients when you leave your office it'll be completely gone. I'm going to have you look back this way here. And you can see they're a little more erythematous, and then when they come back, I always have people come back at 1 month, they'll be gone. Now the last thing we're going to do is pigmentation, and what's nice about the V-beam is it has a new pigmented compression handpiece. So if you're in a room and some of your other pigmented lasers in another room, I love using the V-beam Perfecta to treat brown spots, and we're going to do it on the arm here. And this particular spot presses down and moves the blood laterally so you can treat pigment. Again, no numbing, no gel. You can walk in, do the treatment, and walk out. Patients love it, almost no downtime. So our fourth
what we're seeing
indication,
as a trend with all the devices we're looking at this morning is they're obviously becoming more and more efficacious in terms of targeting the desired chromophores, but also we're becoming more and more time efficient for patients. and the comfort level is there as well. So as you look at all these different devices on the exhibit floor, you're going to be considering what applications you want to start out with. And we're seeing here a variety of applications. I think that the multi-purpose platforms definitely have their benefits. You can mix and match, you can add on additional hand pieces. What we're seeing here is really, it's a multi-use device, a device which is targeting pigmented and vascular lesions, but what we're seeing here from Dr. Weibel is that we can target different areas, both on the face and off the face.
Sounds great. And how's your comfort level with this?
I can barely even feel
Yeah, and this is a very big difference from some of the older kind of devices that we used to use where you had to, it was very cumbersome. First of all, the hand pieces were very heavy. You'd have to switch the different headpiece, if you wanted to do different spot sizes, you'd be searching for all the different spot sizes, the cleaning techniques. These are much more efficient, easy, user-friendly devices that we're evolving towards.
And don't forget, this is my #1 laser I use on men for rosacea. And also when you're getting the face, there's also improving the crow's feet and the texture.
So that's a recurring theme with these lasers as well. They're targeting primarily pigmented and vascular lesions, but we will see this improvement. Some of the companies actually, as we saw with the first demonstration, are marketing on the basis of that. But the important point to take home is that with all these devices, you know, whether it's IPL or whether it's a specific laser targeting pigmented and vascular lesions, we will secondarily see some improvement in skin luster, skin tone, and texture.
So in, I think, less than 10 minutes, we treated 4 applications, and Dr. Carty's ready to go. Thank you.
Any questions?